Physical Therapy and Rehabilitation. At Progressive Physical Therapy and Rehabilitation, we understand that children are not little adults. We have a great reputation for treating young adults and teenagers because we understand their bodies and needs are different. With our vast experience, we know how to properly evaluate and treat their injuries. This is Taylor. Taylor is a prepubescent 10-year-old. She came to us with a muscle sprain of her left knee. Upon further evaluation, we had to take into account her age, her strength, and her activity level. Taylor is strong for a 10-year-old. Her muscle is not sprained. She's actually going through growing pains of her knee. This is commonly seen. People may misinterpret a muscle sprain because they're having joint pain, when in reality, it's growing pains. What's happening with Taylor is that she's strong, so we don't necessarily need to strengthen her here. She has plenty of range of motion, but what physical therapy has done is we've evaluated her activity level. Taylor had gone from playing 2 days of soccer to 4 days of soccer, and her knee started hurting. Initially interpreted as muscle sprain, we diagnosed it as growing pains. We adjusted her schedule, her pain went away. This is Cassidy. Cassidy is a pubescent 15-year-old who was referred to our office with elbow pain. When we're evaluating a child of her age, we have to look at a variety of things. Due to hormonal changes, she's still growing, and generalized weakness, we had to look at her as a whole. Again, she didn't have a range of motion problem. She had a weakness problem and an instability problem. Weakness is very common in children that are growing. She had elbow pain but was unstable from her shoulder and unstable in her core. So when evaluating and treating her, not only are we treating the elbow, but we're also strengthening above and below these joints. What we also have to take into account is that Cassie has variations in hormones. What this does is this creates instability or laxity inside the joint. Cassie is a softball player. So you have to take into account that she's throwing the ball constantly. With that into account, plus changes in hormones and weakness, sometimes we have to rest, sometimes we don't have to rest. Each patient is individually different. Taking a look at Cassidy, we'll look at her as a whole. As a parent, when choosing your child's physical therapist, remember that not all children are the same, and their treatment plans need to adapt to the needs of their bodies.
For more information, please visit us online at progressiveptandrehab.com.